What is an ECE? Anybody can stand and say? It's already written. Early clinical exposure. Okay. So from the from the biochemistry point of view, this is your first ECE, and the topic today is the disorder of carbohydrate digestion and absorption. All right. Just a little bit about exposure, about what ECE is. So this has been added to your curriculum when we were doing MBBS. This was not a part of our curriculum. Neither was EdCom or SDL. But you're very fortunate that these things are being introduced during your time. So this is going to bridge the gap between your clinical experience and your theoretical knowledge. So ECE, it gives you a clinical context behind whatever you're learning right now, be it biochemistry, be it physiology or anatomy. And it will help you participate indirectly in the healthcare system. It will help you understand how the healthcare system runs, how you can contribute into it, what is your role in it. You will see, since it's your first class, we are not bringing any patients, we are not bringing clinicians, and we are not taking you to the hospital. Once some of the topics are covered, then we probably will take you to the hospital as well. You will be able to see the doctor, the clinician, talking with the patient and everything. So in your own experience, you must have gone to doctors yourself or with your parents, or may have taken your parents to the doctors. And you would have known the perspective from a patient's point of view. Or if you have doctors in your own family, you may know perspective from the doctor's point of view. But once you go as a student to those areas, and even through ECE experience, you're going to have the first-hand experience both as a patient and as a doctor as well. So it will give you a whole idea about how the healthcare system in India runs. It will serve as a motivation factor and reference point for you, and will also help in your professional development and growth. You will be able to relate to patients and to doctors, and to the management team as a whole. Even the socio-economic context, the cultural context of a disease. So since we don't have any patient, we will discuss case discussions. So only carbohydrates and some part of lipid and amino acid is done. So this is very early on. We cannot go to very complicated cases. So we have only 2 case discussion today. This is your first case, and we are going to solve it together. All right. So we have a patient named Ashutosh. Please don't talk in the class. So a man named Ashutosh, who's 32 years old, comes to OPD, and he's complaining of pain in the stomach. He's having bloating, he's having diarrhea. After the ingestion of milk or ice cream, he mentions that he has minimal symptoms after having yogurt though, compared to when he has ice cream. All right. When you check the patient, the vitals are all okay, and basic blood tests were done, and they revealed no abnormality, no significant abnormality. This is your case. All right. There are 3 questions related to it. What is the probable diagnosis? What is the biochemical basis of the symptoms? And what is the management protocol in such patients? I think it is fairly easy. What is the diagnosis? Very good. Lactose intolerance. What is lactose? What is a carbohydrate? Carbohydrates are poly. So you all know the answer. Please answer, somebody. Or ketosis, or compounds that gives them on hydrolysis. Very good. Thank you very much. Lactose is a carbohydrate. Is it a monosaccharide, disaccharide, or polysaccharide? Disaccharide. So lactose is made up of glucose and galactose. Very good. So it's a disaccharide. It has glucose and galactose in it, and lactose is found in all the dairy products. What happens in lactose intolerance? We have lactase enzyme or beta-galactosidase enzyme deficient or completely absent in people, and those people cannot break down lactose. All right. So this is the commonest disorder of carbohydrate digestion and absorption that is seen in everybody. Do you have lactose intolerance? Do you think you have these symptoms? So study shows that 90% of the Asian population suffer from or have lactose intolerance. In India, about 60 to 65% of the population have lactose intolerance. But do we take any medicine for that? No, we're just used to it, right? So common. Sources of lactose? Anything that is related to milk. Okay, cheese, butter, yogurt. But some people may be very sensitive to this, and even if they don't take dairy products directly, if they take any product that has milk in it, they may still show these symptoms. Say, for example, if they take bread, bakery items, and all of that can also show. Okay, so it's not only milk. Now we know that it's lactose intolerance. What is the biochemistry behind it? What is the biochemical basis of development of these symptoms? There is deficiency of lactase, right? What happens then? No breakdown of lactose. So what happens to this lactose? It keeps going down. Lactose goes to the large intestine, and then it increases the osmotic load in colon. It increases the osmosis, meaning it puts pressure on the water part of the water content inside the cell and puts it outside of the cell, pulls it outside into the interstitial spaces. So we have cell, and in between the cells, between two cells, there are space. So it pulls the water, lactose pulls the water into those spaces, and that kind of triggers diarrhea. Along with that, this lactose is fermented by the bacteria that is present in our own body, in the intestinal bacteria. By the intestinal bacteria, it ferments lactose to produce hydrogen, carbon dioxide, and what is CH4? So what will happen if methane is produced? You know the answer. Flatulence, okay? Therefore, they'll have this. What is this? This is called flatulence, okay? Some may have diarrhea, stomach ache, and it is usually not severe, so that you can differentiate between some other abdominal component of it as well. So lactose intolerance is not severe. You will have symptoms, vague symptoms like this, and some people may present with nausea and vomiting as well. Now, after the ingestion of these products, people who are lactose intolerant will produce symptoms within the first 2 hours of ingestion, okay? All these flatulence, bloating and everything will happen within 2 hours. There are 2 types of lactose intolerance. One is called primary lactose intolerance and the other is secondary. So in the primary, this is genetic condition. So if parents have it, children may also have it. That's why all the population of India, most of us have lactose intolerance. And the genetic components, there are certain genes that are present that will cause lactose, that will decrease the production of lactase in our body, so leading to lactose intolerance. Okay, secondary is because of some other condition because of which we're having all these symptoms, and these are transient, these are not permanent. These are only certain times when we have these things. Like for example, some patients who are undergoing chemotherapy, they will present symptoms of lactose intolerance. They're not actually lactose intolerance, but they may present as lactose intolerance for a certain amount of time during chemotherapy. Same during gastroenteritis, okay, which we now call as diarrhea in simple terms, and some people having celiac disease. So fairly easy to diagnose such cases, right? From the clinical history itself, if you can talk to the patient properly, take their diet history, history of the drugs, whatever medications they are taking, you will be able to diagnose a patient easily. You don't have to do any test. But just theoretically, if you have to write a short note on this, you can further go for lactose tolerance test, see if the patient can actually, what happens to the patient if we give them lactose. So for that we have hydrogen breath test, stool acidity test. So hydrogen breath test and even glucose test can be done. इसमें क्या होता है, you know, here the intestinal bacteria forms hydrogen when the lactase is absent. Okay, so in hydrogen breath test, they give you a little bit of lactose to ingest, and after that, after half an hour or 1 hour, 2 hour, too early, they will check the hydrogen in your breath, in the breath of the patient. So if there is more hydrogen being produced, what does it mean? Hydrogen from the test kiya. If hydrogen is more, does that mean the person is having the presence of lactase or absence of lactase? Absence of lactase. So if hydrogen breath is positive, which means if there is more hydrogen, then that will be why? Because the intestinal bacteria are the ones fermenting the lactose that we are ingesting. So, and producing hydrogen. Therefore, if hydrogen breath test is positive or increased, then we understand that the patient is not able to digest lactose properly. Second one is glucose, also same thing. And then we have a stool acidity test. What is the pH of stool? Anybody can tell me? So stool acidity is fairly neutral, okay, between 6.5 to 7.5. So if it goes less than 6.5, that will be acidic. So if a person is having lactose intolerance, will the stool be acidic or alkaline? Just think about it, take your time and think about it. Acidic, how many of you are saying acidic? Okay, how many of you alkaline? Okay, to the people who are saying acidic, please explain why will it be acidic? Very good. Lactic acid, because of which? Sit down. Lactic acid, it will not be alkaline because lactose will then get fermented and produced and will be converted into lactic acid. So we know if there is acidic pH, it should be neutral for a normal person, but if it's going acidic, then we know that a person is having lactose intolerance. Apart from that, we can always do genetic testing, which is not required at all. This is a theoretical knowledge, okay? And in India, we don't do these things. We just know that somebody is lactose intolerant. And that's fine. Management then. What can be said to the patient then? Somebody is saying these symptoms are there. Doctor is saying, okay, fine, you have lactose intolerance. So what should be, how do we manage those patients? Yes. Remove lactose from the diet, okay? Anything else? Patient is saying, okay, fine, you're telling me not to take any milk products or anything that is related to the milk. Then, but how will I have my tea then? I love tea. Any substitute? Can you name any substitute? You know the answers. Reduce the intake, okay? उसके अलावा चाय तो everybody drinks चाय. Anybody else? Almond milk, okay, very good. So you can tell the patient if they really want to use, then they can use other substitutes of milk. Soy milk is there, almond milk is there. Has anybody tried almond milk? How is it? Is it good? You like it? No? All good? How many of you have tasted almond milk or soy milk or anything apart from the other milk? Okay, many of you. How many of you like them? You okay? Okay. Some of you are okay with them. How many of you do not like them? Most of you don't like them, right? So you prefer milk? The normal dairy milk? Okay, yeah. So we can tell the patient to have lactose-free diet, which in Indian context is very difficult. We can tell them to decrease the amount of the milk content that they have or any other products that they have that contains milk, or we can give them a substitute like other forms of milk. And we can give them lactase supplements as well. The supplement of the enzyme that is actually not produced, synthesized in the correct amount in the body. Now you must have read this in the first question. Person is saying that if I have ice cream, that makes me have this bloating and stomach ache. But if I have yogurt, I have minimal effect. Why is that? Yogurt is also yogurt or curd, bolo, dahi, bolo. All of those things have milk in them. It's a milk product. So why is he having no symptoms or minimal symptoms with these products? Yes. Yes, that is one of the reasons. Thank you. It has lactobacilli in it, okay? All this yogurt and curd. That's why we say that when you have diarrhea, have these. It will help your digestion. So lactose is present in these things as well. But the curd and the yogurt, whatever it is, they contain lactobacilli. That itself contains lactase, which can then digest the lactose that is present in them. And the lactose that is present in the curd and the yogurt in itself is very low in quantity as compared to taking one whole tub of ice cream. Okay, usually when a person who is lactose intolerant, if he takes just one scoop of ice cream, that's fine. But if he takes a whole tub of ice cream, then the symptoms can arise. Alright, so that's why we are very used to having lactose intolerance, and we just move on with our life as well. So this is clear, right? Now we have the second case discussion. We have only 2 case discussions today. 9-year-old child comes to the hospital with the mother, okay, emergency room, in a drowsy state. What is a drowsy state? Semi-conscious. He is like falling asleep, okay, not responding much to the commands. So bacha is having in a drowsy state. Mother is giving history of passage of watery stool 8 to 10 times a day for the last 3 days, and vomiting as well. So you examine the patient. The child looks very dehydrated, sunken eyes, and decreased skin turgor. The mother is confirming that the child has passed urine and is passing urine regularly. The patient, then you are the doctor, you admit the patient, and the patient is treated. And the mother is told to feed ORS to the child every 30 minutes. So this is your case. Now we have certain questions. What are the components of ORS, or oral rehydration solution, or salt? Can you guess? What will be the component of ORS? Electrolytes? You're right. Yes, sodium and potassium. Okay. Uske alawa? Sodium, potassium, and I don't know if you have heard your parents say that, but if you don't have ORS, if you can make ORS at home as well, the simple ORS. What is that? Pani lo, usme namak dalo, chini dalo, and mix it and drink, right? So what else will we have here? Sugar as well. All right, very good. Now next is what is the importance of inquiring about the urine output. We'll go further into that. The skin turgor and the signs and symptoms of dehydration. This is the component of, सिर्फ sugar salt बोलने से नहीं होगा. Your MBBS students, we should know this. Okay, so sugar is not given directly as a sugar, or salt is not given directly in the form of salt. We have 2.6 gram of sodium chloride. Okay, then we have trisodium citrate 2.9 gram. In the older generation of ORS, bicarbonate was given. Now this is removed. Trisodium citrate 2.9 grams, KCl or potassium chloride 1.5 gram, glucose 13.5 grams, and we have to dissolve the whole thing in 1 liter of water. Now what you see, the ORS packets that come, it comes in sachet of 4, and one packet has 4 sachets, so they will say that you have to dissolve 1 packet in 200 ml of water. So this is the total of the 4 packets. Okay, some give you a big packet, but most of them I have seen they give you 4 small sachets for 1 glass of water. Okay, all of these NaCl, trisodium citrate, KCl are for 1 liter of water. You can mix them in 1 liter of water and give and drink throughout the day. The total osmolarity, very important, is 245 milliosmol per liter. Osmolarity is the concentration of solute per liter of solvent. The importance of it, we will discuss about it in the water balance class. Okay, so I'm not going into details of that. Remember this composition. So the mother told doctors, as a doctor, you have to ask the patient about the urine output in this case of dehydration as well. So why the urine output was asked at all? Urine output matlab, in a day how much urine was passed by the by the child, by the patient. Okay, so why do we inquire about urine output? Anybody? Because you see, this patient had vomiting and dehydration, right? The patient is having diarrhea. The mother said 8 to 10 times a day. That's a huge number for a child, and for the last 3 days. Whenever there is excessive vomiting and diarrhea, there is fluid loss from the body. Okay, and therefore, when the fluid or the water is lost in the diarrhea, in the vomiting, the volume of the blood that we have decreases, and that decreases the blood pressure and also the blood flow to the kidneys. Therefore, the kidney will not be able to form urine normally, and the urine output will be less. So if you know somebody who is not passing urine and is dehydrated, you know the kidneys are going to be affected, if not already affected. Alright, this is understood? So urine output gives us an idea about the condition of the patient and the condition of the kidney as well. So normal color of the urine is straw colored. So we are supposed to pass about 2 liters, 2 to 3 liters or 1 to 2 liters depending on how much water we are taking every day. We should have a urine output of up to 2 liters per day. Anuria means absence of urine, okay, but usually it is not seen in any patient. But anuria, so theoretically, it means that there is no urine, but that is rarely seen in people. So if the urine output in a day, per day means per 24 hours, okay? So per 24 hours, if a person is not passing urine for more than 100 milliliter a day, or if he's passing less than 100 milliliter a day, we call it anuria. Remember, these are new terminologies and it will keep coming again and again, and no one will explain to you again what these things are. Oliguria is another one, which is also decreased urine, should be less than 400 milliliter per 24 hours. Polyuria, where do we see polyuria? Anybody? What is polyuria? Polyuria, anybody? Polyuria means increased frequency of urine. Where do we see this? In diabetes. Very good. So polyuria is one of the symptoms of diabetes. Polyuria means you are passing about more than 300 milliliters of fluid per 24 hours. So that's a lot. 3 to 4 liters of water, so a patient will keep on going to the washroom in case of diabetes, even at night. He's not able to fall asleep because of the frequency of urination that person has. So these are some terminologies I wanted you to know. Next we have skin turgor. We talked about the skin turgor, okay, decreased skin turgor. Skin turgor means elasticity of the skin. So when you pinch your skin, and if it goes back, then it's fine. If it goes back to its normal position quickly, that's fine. But over here you see, it is making a dent over here. It is not, either it's going very slow or it is not going at all. You can check your own skins and see if you need to drink water. You can try it out now. That's fine. So if it's going back, first see the condition of your skin as well. If it is dry, you need to drink water or you need to have a good moisturizer. If not, if it's going, all is going back fine, all of your skins are fine. Anybody has loose elasticity? No? All fine? Okay. This child had reduced skin turgor, which means delayed skin turgor, which means the skin was not coming back to its normal position quickly. Okay? It's a sign of dehydration. Then other signs and symptoms of dehydration will be increased thirst, obviously because water is not there. They have not like, I'm feeling thirsty right now because I'm sweating. Next thing is irritability. You will see in patients. Sometimes, even us as people, if we don't take care of ourselves, we will feel headache and we will feel agitated. You will not find a reason why that's happening. Many of the times it's because we are dehydrated. We are not taking our water. Okay? Drink water every day and frequently. Dry mouth, you will see the tongue. You can check the tongue of your other friends. You can just pull out you can show your tongue to your friend and then you can see. It should be moist. There should be a layer of water, a layer of moisture there. If it is completely dry, that means they are dehydrated. You will see this in many patients who have diarrhea and vomiting. Okay? Decreased urine output, like I said already. Sunken eyes, especially in children, you would see sunken eyes. That's not a good sign, okay? Eyes are gone inside, under the bawa, okay? It will look like that because of dehydration. Headache and high colored urine. So what is the normal color of urine? I told you already. Straw color, okay? Somewhere like this. But if your urine is high colored or it is more, that means it's more concentrated, the fluid is very less in it. So the darker it goes, the worse it is for you. Keep a check on your urine as well. You would see if you do not have time to drink, especially in these conditions where you're always in the AC all the time, and then you don't feel thirsty when you're in AC. You will hardly drink water. I don't know how many of you bring your own water, but if you don't bring our water, somebody's drinking water already. If you don't bring your own water, you don't drink frequently, then you go out, you go to washroom and you will see the color. You can always see the color. Sometimes we forget, right? So when you see the color, if it is orange color, if it is brown color, darker than what it should be, that means you need to drink water, okay? Your kidneys are functioning over time. So which one of the ORS will you take or give to the patient if somebody is dehydrated? The first, the middle one, the first, second, third, which one? How many of you say first one? This one? Okay. Then next one. Consider yourselves doctors and let's see what you... Okay. The third one? Okay. I want to know your opinion on first one. Why will you give the first one? A person, this patient, to this bacha who has come. Okay. To the patient you're going to give this. Okay. The next, anybody who is saying the middle one? This is in powder form. Which one? Who will give powder form? Okay. Please explain why you will give this and not this or that.
This first and the third are flavored ORS. There is artificial flavors. Because orange is written, then apple is written. They might use flavors in it. So that was some problem. And moreover, in this second one, they have written ORS, means orally admitted solution. In here, there is ORS. I think some name is also misleading.
Okay. Okay. Please sit. Thank you. And the third ones, those people who are saying third one from this row, from this column, I think. Yes. Okay. Please explain why will you give the last one, apple wala. Okay. Please sit down. So the previous, this one is the WHO recommended solution. Okay. So any ORS that you're going to take for yourself or for your friends or the patient or your parents, this should be written at the back. This is the formula. This is WHO formula. This is not biochemistry formula, okay? This is recommended by WHO. And this should be there. Every single word, digit should be there. So anything that doesn't have them should not be given to a person who has acute diarrhea. A patient should not be given this. If you want to just have, that's okay. I'll tell you, this is the one that you're going to give to the patient. I have no idea about this one. Do anybody who is aware about the recent ORS problem that happened? Yes? What was it regarding? It was regarding this one. Because the company of ORSL was making, like you said, I think this is misleading, the name also. So anybody who's giving ORS, since the name is also written, ORS, so everybody will just take it. Even the doctors started recommending it, okay? But the problem was that at the back, if you read of this ORSL, if it is still in your homes, the content of it is not the same as being recommended by the WHO. What happens is that it will not act as a medicine in case of an acute diarrhea. It has a high content of sugar as well, and all of the electrolytes, and you will learn about it later on as we progress in biochemistry, how much electrolytes are important for the body, and a little difference in electrolytes can kill the patient. We don't know how this is going to act in a patient who requires immediate replenishment of their fluids in the body. So along with the saline that we're giving, so somebody is in a hospital, they will not be getting this, of course. Fluid loss will be replaced. But somebody who's at home and is not, while they are going to hospital, can always take this this is what you will read, the whatever is written at the back of that packet. Okay, if this is what you're recommending, please check. I have not checked it myself. Either mein kuch bhi likhega, but you as a doctor should be very skeptical about each product that you're giving to your patient, especially marketing products like this. This is from the same company of this, so we don't know how this is. But if it is WHO recommended, to hai yahan likha hai. But at the back of it, please check if the composition is the same. All right. So this is the class for today. My class.